is barely rising, but Julienne Kinda is already on her motorcycle. Dressed in her overalls, she's on her way to her first customer of the day. Julienne Kinda is one of Burkina Faso's so-called VVVs, Village Volunteer Extension Workers.
My job is to vaccinate poultry, raise awareness among producers, and provide training. With breeding, there are always mosquitoes. Now, if the producer is sick, our work will slow down. So when we come to vaccinate or raise awareness or just bump into each other, I introduce them to Maïa. At first, they were hesitant, but I encourage them to try it first. If it's not effective, they shouldn't pay me. But if it's effective, they send me my money. To send how many jars? Just one with your wives and then your children there.
Maïa is an innovative anti-mosquito ointment created to protect African families from malaria.
Maïa, really? Since I first heard about it, I haven't paid for any more mosquito coil or anything like that. So I find that because in the rainy season here, there are mosquitoes everywhere. When you're outside after 6 p.m., if you don't put ointment on yourself, you can't sit down.
With vaccination, we're able to go a bit further into remote villages, and that gives these people access to Maïa for good protection.
In addition to her work as a vaccinator, Julienne Kinda has a second job.
I'm going home to change so I can go to the service now.
The service is here in this maternity hospital in Boromo. Julienne works here as a health assistant. Her duties include HIV screening for expectant mothers. It's also an opportunity for her to promote prevention among these women, who are among the most vulnerable to malaria.
When evening comes, you have to sleep under a mosquito net. Do you know that malaria and pregnancy don't mix?
Malaria is very dangerous for pregnant women. Maïa really helps us when it comes to protection. It's true that we give them mosquito nets, we give them preventive medication, but at least during the periods when they're outside or at home doing things, they can use this, and it helps them a lot.
To keep track of sales, Julienne has an application, accessible from her cell phone, called Kobo Collect.
So when you open Kobo Collect, you fill in a form. Now I have two notions, Maïa order or Maïa distribution. I'm currently distributing Maïa, so if I go in, we ask for awareness, sample distribution, and deposit sales. So I haven't given out any samples here, so I've raised awareness and I've sold 3 jars. The data is already gone. So from Ouagadougou, they know where I am and how many boxes I've sold. Even in the village, we do it. And if there's no connection, as soon as you get back to where there is a connection, it's gone. They know where you've been and how many pots you've sold.
People living in rural areas are 4 times more affected by malaria than those living in urban areas. So solutions had to be found to bring Maïa as close as possible to the people, even where access is difficult. The idea came to rely on intermediaries, community-based health agents, more commonly known as ASBC.
My name is Zalissa Zoungrana. I'm in charge of raising awareness among the population, often through home visits or educational talks. I arrive, I send my picture box, I send a notebook and the picture box I take. I show them the photos and I ask them what they see, what's going on, and then I explain to them what's in the picture box. And when I've finished, I take out my notebook and record the number of people who took part in the visit or the talk. After the visit or after the talk, I explain the role of Maïa, and they buy. They really appreciate it.
Zalissa works jointly with Healthy Entrepreneurs, a social enterprise, founded in 2012, which provides basic health services, sells essential medicines and disseminates health information in remote areas of the country.
All the HE products marketed by the community-based health agent are quality health products in line with the themes addressed at family and concession level. Our mission is to reach the last mile. It's a real opportunity for us to be able to market products. Because if an ASBC is more than 5 kilometers from a town or a health center, for its population to have access to Maïa mosquito repellent ointment, they have to travel, buy them in stores or food stores, and the cost is very high. Not to mention the cost of transport. But now that Maïa is available from community health workers, people no longer have to travel dozens of kilometers to get Maïa mosquito repellent ointment. What's more, the cost is reduced for community health workers.
In Pa, a town a few kilometers from Ghana, Fati Zongo is a charismatic Maïa saleswoman. Full of humor, she often likes to joke with her customers.
I spoke with her husband. You have to pay a lot of Maïa. It helps you. But since they're happy today, I think you'll pay for 3 jars. For your child, for you, your husband, and then your other wife, you're going to pay 3? Okay. You need to act a bit to entertain people and be able to work. If you work with households, people with tight faces, nobody's going to want to work with you. But when I arrive and see the women with tight faces, I ask them, what's wrong with you? Didn't you have breakfast or something? I say, men, why didn't the women get anything? Look at them, the men there. I start like that. At the end, I say that I came with Maïa to sell some. After Maïa, I also say that I train people in poultry. I give you follow-ups. If you work in poultry, you'll have the money to pay Maïa. You'll be healthy, and you'll eat good meat too.
As a Maïa saleswoman, you don't have to hesitate to come to your home to deliver the ointment, but you can also remind people of a few tips to protect themselves from malaria, especially in the rainy season. Maïa fits into the daily routine of African families, that of applying ointment to children after bathing or showering, when they are particularly vulnerable to malaria. A child dies of malaria every 2 minutes around the world.
This ointment, as soon as you put it on, it shines. You think you put too much on, but no, it's the ointment itself that's shiny.
Many families have understood what Maïa is. They're the ones who call me every time. If I take the 2 boxes like that, they don't even last a week at home. That's because I have a lot of customers who order Maïa. They've understood how Maïa helps them with their housework. When I'm on tour, I show people what Maïa is like. I can't even go into a family and they don't pay for Maïa. I've never gone into a family and explained how Maïa works, and people don't pay. Even if it's 2 jars, 1 jar, they'll pay and then they'll call me to recommend it.
Because the ointment is made with good ingredients. Something made with honey is good and effective.
And even in remote villages, like this one just a few kilometers from Ghana, Maïa ointment is now accessible. Gathered under this tree, the women listen to Fati raise awareness of the need to protect themselves against malaria.
The day before yesterday, I was already here with Maïa. So I asked them, all those who have used Maïa since the day before yesterday, just tell me what they think. There are others who are here but didn't have Maïa the day before yesterday. All they have to do is testify and say what Maïa is like, so that others will have confidence and buy some. The women say they've used Maïa, and will buy more. Now I'll grab my loincloth and collect the money. Some took 2 pots, others just 1. So I collect the money in my loincloth.
Every day, Maïa works to bring its product closer to the people, even in remote villages in Burkina Faso, to enable them to protect themselves effectively against mosquitoes, the carriers of malaria.